In the cutting-edge world of today's healthcare industry, Mako is leading the way with a truly revolutionary diagnostic instrument. The Ero Scan Pro, the only handheld combined otoacoustic emission and tympanometry system in the world today. Capable of performing a complete sequence of OAE TIMP tests in as little as 30 seconds, and then instantly providing test results on screen, paper, or PDF. Lightweight, completely portable, and battery-operated, this system can be used in almost any environment to test everyone from infants to adults. The Ero Scan Pro is simple to use with its intuitive interface, designed for fast and easy operation. Combining advanced diagnostic capabilities, customizable settings, and an optional patient management database, the Ero Scan Pro is truly a joy to use. This powerful device is the perfect tool for physicians, audiologists, and all screening personnel. Elegantly designed, feature-packed, and engineered to last. The Ero Scan Pro by Mako. Hello, and welcome to the Ero Scan Pro Quick Start Guide. This guide is a supplement to the training and support provided to you by Mako's Special Instrument Distributor Network. This section of the program is designed to help you begin your first test as quickly as possible, so let's get started. We'll cover detailed setup instructions later in this DVD. The entire Quick Start process can be completed in 8 easy steps. Locate the 4 AA batteries provided with the Ero Scan Pro, slide open the cover, and insert them into the compartment. The proper way to insert the batteries is shown on the battery label. While the unit can be used by itself, many users prefer to use the Ero Scan Pro with an external probe, so let's follow that example. Plug the probe into the input jack located on the top of the device. The arrow on the connector should be aligned with the instrument control panel. It can fit in only one direction. The Ero Scan Pro will detect the external probe during the power-up process. Select a disposable ear tip from the kit that was supplied with the system and place it on the probe. The proper ear tip for each patient will be the one that is sized correctly to seal the probe in the ear canal. Power up the unit by momentarily pressing the power button located on the control panel of the Ero Scan Pro unit. When the unit powers up, Quick Screen will be displayed on the menu. This test is a good general screening protocol, and we'll use this test in our example. Prepare the patient for testing by having them sit in a comfortable position in a quiet area. This step is necessary because environmental or patient noise can cause a test to refer. Then secure the external probe to the patient by using the attached lanyard as a neck loop or by cinching it up and then using the shirt clip to attach it to the patient's collar or other article of clothing. Be sure to have the probe housing close enough to the patient's ear so that the housing does not pull on the probe tip. Insert the probe into the patient's ear canal far enough to ensure a tight seal. Then, start the test by pressing the button for the appropriate ear on the probe housing or the Ero Scan Pro itself. Once the test is complete, the results can be viewed on the Ero Scan Pro's display screen. The display will indicate either a pass or refer, and display the frequencies tested. A pass indicates the subject passed the screening test. A refer means that the subject should be retested or referred for further testing. This test is automatically saved in memory. A few seconds after the test result is displayed, the screen will change and give you a selection box. The options listed here are designed to be intuitive and easy to use. Starting from the top, they are left ear test, right ear test, done, which takes you to the main menu, and review, which shows you results of the test just completed. Congratulations! You've just done your first screening. For more information on any part of this process, please go to the detailed explanation later in this program or consult your operating manual. The Ero Scan Pro has been designed for you to be easy to use, yet powerful in its capabilities. Our goal is to aid the clinician by increasing test accuracy while decreasing testing time. Let's begin to explore the Ero Scan Pro with an overview of the control panel. Later in the program, we'll cover the internal and external probes as well as the testing process. Located on the face of the unit is the user interface or control panel. This panel contains all of the controls and status indicators used in the operation of your Ero Scan Pro. In the center of this control panel is the Ero Scan Pro's display screen. This display is your link to a wide range of valuable information, including everything from device setup parameters to test results. After powering up the Ero Scan Pro, we see the main menu displayed on screen. Shown on this screen are the battery level indicator, the additional information icon, and the main menu selection options. Located on the left of the screen is the selection scroll bar. This bar indicates your current position in the list of selections available in the main menu. Upon power-up, the Ero Scan Pro always defaults to the last test used. At the bottom of the display is the navigation bar and the options available for the current selection. By pressing the corresponding direction arrow on the navigator, the desired option is selected. In other operating states, the display will show us test results, setup menu options, and numbered patients. Now, let's move on to the lower portion of the control panel, where we have the 3 operating controls. Located on the left side of the panel is the power button. This button turns the unit on or off by simply pressing it. Pushing the button momentarily turns the unit on. Pushing and holding the button turns the unit off. As a power-saving device, the Ero Scan Pro automatically turns itself off after a few minutes of inactivity. The results of any test you performed are automatically saved before shutdown occurs. Below the power button is the 4-way navigation selector. You can view this navigator as the control center for the Ero Scan Pro. This control is designed to be very intuitive to use. The up and down arrows are used to scroll through the list of selections. The right and left arrows are the action buttons used to make a selection, such as starting a test. Above and to the right of the navigator is the info button. This button is used to display additional information for various items, such as test results. The information icon, shown here on the display screen, indicates items that contain additional information. This icon will be present if an item has additional information available. To use this feature, simply select an item that contains the info icon and press the info button. The display changes to show the results. Finally, located at the top of the control panel are the test status indicators. These 3 indicators alert you to the status and various operating conditions of the Ero Scan Pro. The amber status light means that one of the following conditions has occurred. There was a noise present during a test, good ear tip seal was not maintained, or that an error condition exists. The yellow status light indicates that a test is currently in progress. The green status light means that the unit is on and ready to test. Now that we've covered the control panel, let's switch our attention to the Ero Scan Pro's internal and external probes. These probes allow ease of use and flexibility in testing a wide range of subjects. First, let's cover the internal probe, which is located on the opposite side of the instrument from the control panel. This probe incorporates a patented noise isolation design, which prevents handling noise from interfering with the testing procedure, a common problem in handheld OAE devices. The probe consists of 3 main elements: the probe assembly, the probe tip, and the ear tip. The probe assembly incorporates the microphone that senses the OAE information present in the ear canal, as well as the tubing that delivers the stimulus. The probe tip is the interface between the probe head and the ear tip. These probe tips are disposable and should be replaced when they get clogged by earwax or other material. The ear tips, which cover the probe tip, are soft inserts that protect the ear canal while gently sealing it from external noise. This seal is what allows accurate testing. These tips are made from an industrial elastomer and are designed for a single patient's use. The compact design of the Ero Scan Pro's internal probe allows rapid testing on cooperative patients, such as older children and adults. This probe provides DPOAE measurements from 1.5 to 6 kHz and TEOAE measurements from 0.7 to 4 kHz. There are also 2 types of external probes available for the Ero Scan Pro. These probes operate in the same manner as the internal version, but offer significantly enhanced testing capabilities, as well as the versatility to work with difficult-to-test populations, such as infants, young children, and individuals with multiple handicaps. Please note that the same ear tips are used with all internal and external probes. All of the external probes consist of three main elements: the probe tip, the probe head, and the probe cable. The external probe enclosure features easy-to-use selector buttons. These buttons allow the user to test the left or right ear without accessing the controls on the Ero Scan Pro. This can be very helpful with many test subjects. The external probes also have an amber or blue light under each button to indicate the ear being tested, as well as a status indicator. The green status light means that the probe has been detected by the Ero Scan Pro and is ready to test. A flashing yellow status light indicates that auto start is in progress, and a solid yellow means that a test is in progress. Of the two external probes, the OAE probe offers the same TE-OAE specifications as the internal probe, while extending the DP-OAE range from 6 to 12 kHz. The TIMP-OAE probe encompasses all of these testing ranges and adds tympanometry measurements to the device using either a 226 or 1000 Hz tone. Mako is the first in the industry to add tympanometry measurements to a handheld OAE device by simply adding a probe. Please note that in order to perform tympanometry or high-frequency DP-OAE measurements, you must use the appropriate external probe. For more information about your Ero Scan Pro and the external probes, please refer to your operating manual. In the manual, you'll find lots of in-depth information and definitions to help you get up to speed quickly. As with any procedure in the medical field, using the proper testing technique is a key element in obtaining accurate results. This section on measurements is based on real-world situations and should be studied thoroughly in order to obtain maximum results. The first step when conducting a measurement should be to put the patient at ease. Explain to the patient that the measurement is painless and all they need to do is sit quietly while the test is in progress. You should inform the patient not to swallow, chew, or move during the test, as this could introduce noise into the measurement. Whenever practical, the next step should be to do an otoscopic or visual examination of the patient's ear canals. Excessive cerumen or vernix in the ear canals may interfere with the test and give invalid or incomplete results. Patients with excessive cerumen or foreign matter in the ear canals should be referred to an audiologist or physician for removal of the blockage prior to testing. If the canals are clear, place the patient in a position that permits easy access to the ear and allows the Ero Scan Pro to be held steady while testing is in progress. If you're testing with the internal probe, simply press the power button to turn the unit on. If testing with an external probe, first connect the probe to the external probe port located on the top of the unit, and then press the power button. When the probe has been detected, the status indicator on the probe enclosure will illuminate green. All available protocols will appear in the main menu when the instrument is powered on. Please note that the tympanometry protocols will only appear in the main menu when the TIMP-OAE probe is attached and recognized by the Ero Scan Pro. Now we need to select an ear tip to insert over the probe tip. The Ero Scan Pro comes complete with a storage box that contains assorted sizes of disposable ear tips. These ear tips are color-coded for size. The proper ear tip will completely seal the ear canal and should be inserted gently, deep into the ear canal opening. The fit should be secure enough so that the probe will remain in the ear canal even with a light tug on the probe. If you're unfamiliar with OAE testing, please seek someone with proper training and experience to select the appropriate ear tip size and perform the probe insertion. After selecting the proper ear tip, push it onto the probe tip until it is flush against the base. To remove it, grasp the ear tip at the base and twist it while pulling it straight off the end of the probe tip. To ensure the patient's safety and a proper fit, you should only use the ear tips that are approved for use with the Ero Scan Pro. Contact your distributor or Mako for ordering information. Remember, the ear tips are disposable and should be replaced after each patient. Please do not attempt to clean or reuse these ear tips, as this poses a potential risk and can lead to erroneous test results. Once you have the proper probe tip inserted into the patient's ear canal, you can use the up-down arrows on the navigator to choose the desired protocol from those available in the main menu. Selecting either the right or left ear with the navigator starts the testing process. For ease of use, the instrument always defaults to the last test protocol used. Remember, the tympanometry protocols will only appear in the main menu when the TIMP OAE probe is attached and recognized by the Ero Scan Pro. For detailed information on the protocols available in your unit, please refer to your operating manual. As we mentioned earlier, using the proper technique goes a long way towards a successful outcome. This fact is certainly true in OAE testing. Experience shows that it may take up to 3 months to become completely proficient in selecting the proper ear tip and positioning the probe in the patient's ear canal. While the Ero Scan Pro is designed to mechanically and electronically reject noise during the testing process, you should eliminate as much noise as possible to ensure an accurate test. Common sources of noise contamination found during testing include holding the probe in the patient's ear canal, room noise, and the patient's own talking, chewing, or other movements. Now let's cover the steps used when developing the proper technique. They're easy and with time will become second nature. First, as we just mentioned, eliminate as much noise as possible in the testing area. Then, make the patient comfortable by having them sit or lay down. Once they're settled, secure the external probe to the patient either by using the attached lanyard as a neck loop or by cinching the loop up and then using the shirt clip to attach it to the patient's collar or other article of clothing. The probe enclosure should be placed close enough to the patient's ear so that the probe cable has room to flex and cannot pull on the probe. Insert the probe into the patient's ear. To further assist you in reaching proficiency, please use these helpful suggestions. When testing newborns, as well as young children and people with multiple disabilities, using an external probe is extremely helpful in obtaining accurate readings. The probe allows excellent flexibility when positioning and using the instrument on these sometimes difficult-to-test subjects. When testing a newborn, you should position the probe enclosure so that there is no weight on the probe cable, and it is directed away from the newborn's hands. Once you have the probe enclosure placed correctly, push the probe into the infant's ear canal while gently pulling down and back on the pinna. This action straightens out the ear canal and reduces the chances of a read error due to the probe tip encountering the wall of the ear canal. The best time to perform your testing is when the infant is sleeping. If this is not possible, a pacifier may be used to calm the newborn. You should be aware, however, that the sucking action will add noise to the test and decrease the likelihood of a passing result. When the newborn is calm, begin the test. Swaddling the infant in a soft blanket can help prevent unwanted noise caused by the baby's movements, as well as minimizing the chances of the probe being pulled out of the ear canal during the testing process. As you can see, the process of testing a newborn is much easier when using the external probe. When testing young children, quiet toys should be used to distract the child during the testing process. Ideally, these toys should be something the child can hold on to. This keeps their hands occupied, which prevents them from pulling the probe out of their ear canal. Here again, attach the probe enclosure close to the patient's neck. This way, you can keep any weight off the probe cable and away from the child's grasp. In some cases, you may find it preferable to attach the probe enclosure to the caregiver rather than the child. For these younger children, some users prefer to allow the child to adjust to the probe in their ear before beginning a test, while other users prefer to begin the test prior to inserting the probe into the ear canal. The later technique allows you to have both hands free to place the probe and divert the child's attention. This is really a matter of user preference, since the test will not begin until a proper seal with the ear canal has been made. A complete testing sequence in the Ero Scan Pro consists of 2 parts. They are the auto start process and measurement phase. Once the user selects an ear to be tested, the auto start process begins, and the placement of the probe in the ear canal is checked by measuring the responses of a series of low-frequency alternating tones over time. This process also checks to see that the probe or probe tip is not blocked and that there's no extraneous noise present. When the level of the responses remains within an acceptable range and is stable over time, the unit proceeds with calibration and testing. If there's a problem during the auto start process, the Ero Scan Pro's display screen will assist you in correcting the issue. Let's view some examples of the OAE auto start screens. This display image indicates the probe may be outside the ear canal, or that a proper seal does not exist. Carefully continue inserting the probe into the ear canal. If the condition persists, a different ear tip may be required to ensure a proper seal. It's also possible that the probe tip may be clogged and requires replacement. Earwax and other debris can clog the probe tip ports and cause the device to abort the test. This is easily fixed by simply replacing the probe tip. This display image indicates the probe is in the ear canal, and the test will start soon as long as all other conditions of auto start process are met. If the test does not begin, this may be the result of probe instability, where the fit in the ear canal is not continually secure. Additional causes can be that the patient is too active or there is excessive noise present. This display image indicates the probe is blocked. The ear tip or probe tip might be blocked by cerumen, vernix, or the probe may be against the wall of the ear canal. To correct this, remove the probe from the ear and check for wax or debris in the probe tip. Then reinsert the probe. If no issues are found, the Ero Scan Pro continues with the calibration and testing steps. During the OAE testing process, the display screen will show the progress in real time. The green ready light will illuminate once testing has been completed. If you'd like more detailed information on the testing processes, please consult your user manual. The results of the test are instantly and automatically saved in flash memory once the test has been completed. They'll be saved even if the unit is turned off or the Ero Scan Pro's internal batteries are removed. They'll be displayed on the device's screen and show the following information: the ear tested, a graph of the results, frequencies tested, and whether the test was a pass or refer. A pass indicates the subject passed the screening test. A refer means that the subject should be referred for further testing. Please be aware that the Ero Scan Pro saves only the last test for each ear per test protocol. So, for example, let's say you tested a patient's left ear with protocol A. If you start another test on the left ear using protocol A, the previous results are erased and cannot be retrieved. Protocol A's right ear results and the results for other protocols remain unaltered. For reference or archival purposes, the test results should be printed before a new patient is tested. You can choose to never erase any test by using the optional patient management software and enabling the optional advanced feature called Patient Names. If you'd like more information on this option, please contact your dealer or Mako. The default mode for saving patient test results is to save only the last patient's information. This operating mode assumes that you're seeing only one patient at a time and that you'll print those results before going on to the next patient. If your workflow is such that you'll test multiple patients before printing the results, you can change the mode to numbered patients in the setup screen. In this mode, you can store all of your patient's test results by a number. For instance, patient 1. Once you complete a test for patient 1, the Ero Scan Pro creates a patient 2. An unlimited number of patients can be created and stored in this manner. The last patient number is always blank, and you should scroll down and use it when testing your next patient. There's also an option available called Patient Names. This option allows you to save the patient's test results under their name instead of a number. This can be a valuable asset in newborn hearing screening programs or for audiologists evaluating reoccurring patients. This is an example of the DP-OAE test result screen. Let's go over this in detail. Each frequency used in the test is indicated by one vertical column. The number of columns shown will vary depending on the protocol you selected. The signal-to-noise ratio, or SNR, of each frequency is shown by the vertical axis. The height of each column represents the value of the SNR for that particular frequency. For example, if the column goes to the top of the display, then the SNR value is 15 decibels or greater. A solid yellow column indicates that the SNR pass criteria for that particular frequency was met. A darker hashed column means that the pass criteria was not met. This is an example of the tympanometry test results screen. On the left, you can see a graph of the tympanogram. The curve that appears on the graph represents the movement of the eardrum during the test. The area surrounded by the box is valid for normal tympanograms. When the peak of the curve appears inside the box, the screening is generally considered a pass. The arrow, located here on the vertical axis of the graph, represents the ear canal volume. Every age group has a range that this volume should fall within. If the volume is greater than expected, a perforated eardrum may be the cause. To assist you in learning more, an in-depth explanation of tympanometry or OAE results can be found in your Ero Scan Pro operating manual. Once your testing of the patient ear is complete, pressing any arrow on the navigator brings up an option menu where you have 4 choices. Starting from the top, they are left ear test. This will begin the same test protocol on the left ear. Then we have right ear retest. This will repeat the same test protocol on the right ear. Next in the list of options is done, which returns you to the main menu where you can select another ear or protocol. And finally, we have the review option, which will return you back to the test results screen. After reviewing the test results, you can press any button on the navigator to bring up the option selection box once again. Please note, to test a full series, you must return to the main menu and select the ear to be tested. Now that we've covered testing, let's move on to reviewing and managing the results. To review any previous test results, use the navigator and scroll down the main menu options until Show Results is visible. Pressing the right arrow on the navigator will select it. This will then bring up the Review Results selection. Pressing the right arrow on the navigator once again will select it. Here, you'll see all tests saved in the instrument. Each row shows a summary of one test, including the ear tested, the test result, and the protocol used during the test. The test results are indicated by either a check mark, which indicates a pass, or an X, which indicates a refer. To view the details of a highlighted test, press the right arrow on the navigator to select it. The results of that test will be displayed on screen. Pressing any key once the test results are displayed gives you the options Delete, Done, and Review. Pressing the up arrow selects the Done function and returns you to the test results menu. If you select the Delete function, you'll be asked to confirm it before the results are actually deleted. If you wish, you can also delete all of the test results stored in the unit. To do this, go to the main menu and select Show Results. When the screen changes, scroll down the menu options to display the Delete All option. Pressing the right arrow selects it and asks you for confirmation. Clicking Yes deletes all of the files stored in the Ero Scan Pro's memory. The Ero Scan Pro can quickly print all the test results stored in the unit. In order to be able to print, you must have completed the system setup, which is described in detail in the next section. In the default mode, which is the single patient mode, or in the enhanced mode called numbered patients, all tests will be printed when the Ero Scan Pro is placed in its cradle. For this to happen, the Print Results application must be open on your PC. This application allows the option to print to either a PDF file or directly to the default PC printer. The details of this software setup are explained in the System Setup section. Once the test results are printed, they're flagged for deletion. When you run the next test, the previous results are then deleted. This is a fail-safe so that if there's a problem printing, the problem can be corrected, and then the test results can be printed again before you run the next test. To print all test results, place the Ero Scan Pro in the printer cradle. All of the saved tests will print automatically. For more information on printing, please refer to your operating manual. If you're operating in the optional Named Patients mode, you can print any individual test or all of the test results for a selected patient. To print any individual test stored in the unit, it must first be retrieved and displayed on screen. To do this, follow the directions just described in the review section. Then place the unit in the printer cradle. The test displayed will print automatically. When your Ero Scan Pro system first arrives, you'll find it has the following items: the Ero Scan Pro handheld unit with internal probe, an external probe, the cradle, internal probe tips, external probe tips, an ear tip kit, the USB cable, 4 AA batteries, and the software CD. To set up the Ero Scan Pro system, let's start by installing the 4 AA batteries into the Ero Scan Pro. Begin by sliding open the cover and inserting the batteries into the compartment. Then close the cover. The proper way to insert the batteries is shown on the label inside the battery compartment. Next, let's cover connecting the Ero Scan Pro's docking cradle. This cradle can be connected to your computer, where results can be printed to a PDF file or paper. You can also connect the cradle directly to the optional thermal printer. As we examine the underside of the cradle, you can see there are 2 jacks located here. This jack is the connection point for the optional thermal printer, and this jack is the connection point for your computer. First, let's cover connecting the Ero Scan Pro to your computer. Begin by inserting the software CD into your computer and following the prompts to install the software and drivers. Detailed instructions can also be found in the operating manual. To print to your computer's default printer, connect the supplied USB cable to the USB connector on the cradle and then to your computer. These connections are designed to fit in only one direction. Once the connections are made, make sure that the button on the cradle is in the depressed position. This routes the cradle output to the computer connection. Then, open the Print Results program on your computer and place the Ero Scan Pro into the cradle. A desktop computer icon should appear on the instrument. Open the Preferences panel on your computer and select whether the test results will be printed as a PDF or printed on your computer's default printer. You can also select the Remember the Selection checkbox so that you'll not be prompted in the future. If you prefer instead to print to the optional thermal printer, it's also an easy process. Let's go over this configuration. First, plug the supplied power adapter into the power input jack on the rear of the printer, and then into an AC outlet. Next, connect the printer's data port to the Ero Scan Pro cradle using the supplied cable. These connectors are designed to fit in only one direction. To use the thermal printer, the switch on the cradle must be in the up position. Open the printer cover. With the paper curling up and away from you, insert the roll into the printer. Then close the printer cover. The printer should auto-feed approximately 1 inch of paper. This ensures correct alignment and confirms the paper is feeding smoothly. The front panel LED will turn green, and the printer is now ready to receive print data. Place the Ero Scan Pro in the cradle, and printing will begin. If the printer has not been used in a while, it may have gone into the sleep mode to save power. To wake it up, push the status indicator button once. For complete details on the setup topics, please refer to your operating manual. There are 2 useful options available on the Ero Scan Pro that may be a benefit to your workflow. The first is Patient Names. This option allows you to save the patient test results under their name instead of a number. This can be beneficial for many uses, including the ease of record keeping for ongoing patients. The second option is the ability to create custom protocols. This would be advantageous for those users who do more advanced testing and want to create a protocol with different frequencies or when combining test protocols. For more information on either of these options, contact your distributor or Mako. Your Ero Scan Pro requires no regular maintenance beyond a routine cleaning and replacement of the 4 batteries in the handle when the battery icon indicates they're low. Also, an annual calibration check is recommended to make sure that your unit is operating within specified guidelines. If the handheld unit or probes need cleaning, they may be wiped down with a damp cloth and a mild antiseptic solution. The probe tips on the handheld unit or the external probes require replacement only when they become clogged. These tips are disposable and no attempt should be made to clean them. To replace the tip on the handheld unit, squeeze the tabs and pull the old tip off. Discard the tip. Place a new tip on the probe and push down on one tab at a time until it clicks into place. Be sure to tug lightly on the probe tip to verify that the tip is securely attached. To replace the tip on either of the external probes, release the tabs on either side of the probe and slide the tip off. Discard the tip. Align the replacement tip using the notch on the end of the probe and slide into place. Once the tip is pushed all the way on the probe, press lightly on the tabs to snap them into place. If seated properly, the tip will be flush with the body of the probe. Since the Ero Scan Pro is designed to be easy to use, this is all it takes to keep your unit in tip-top shape for years to come.